Now that children are eligible for the COVID-19 vaccine, families are considering how best to keep their kids safe and healthy. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly with AHA Communications. In this new podcast series, Joining Hands to Build Pediatric COVID-19 Vaccine Confidence, we're speaking with leaders from 3 national organizations to discuss how to address vaccine hesitancy, specifically in historically marginalized communities. AHA's Priya Bathija, Vice President of Strategic Initiatives, moderates today's conversation with Juliet K. Choi, President and CEO of the Asian and Pacific Islander American Health Forum. They'll be discussing what it takes to build confidence in the COVID-19 vaccine among Asian Americans and Pacific Islanders. This podcast was funded in part by a cooperative agreement with the Centers for Disease Control and Prevention. The contents of this resource do not necessarily represent the policy of CDC or HHS and should not be considered an endorsement by the federal government. And now, over to Priya.
Juliet, thank you so much for joining us today to talk about vaccinations in the Asian American, Native Hawaiian, and Pacific Islander communities. Your organization recently released a report about the nationwide COVID-19 survey you conducted of diverse Asian American, Native Hawaiian, and Pacific Islander communities. Can you share what you learned from that report and what you're seeing related to COVID-19 in your community?
Sure. Thanks so much, Priya. This conversation is, just in my heart and in my gut. So personally important as well. As a daughter of Korean immigrants, like so many of us, I think we bring our family stories and concerns to our work that we do. The survey that we conducted earlier this year, it was in partnership with the COVID Collaborative, and I want to highlight that we wanted to amplify that with a survey that we conducted just in the fall, reaching out to our community partners, our network of community partners. Some top-line findings, some of this may be surprising, some of this may be further affirmation, but I want to say at the outset, when we set out to do the survey, what we realized was there really was no dedicated survey to really reach in a deep, meaningful way into the diversity of the Asian American, Native Hawaiian, Pacific Islander communities. So at the outset, if I can sort of nerd out for a moment here, we're just so proud that in partnership with the COVID Collaborative and Heart Research, we actually surveyed over 1,500 adults across the country with the Asian American, Native Hawaiian, Pacific Islander communities. What we did find is that there has been a real greater sense of impact of the COVID devastation within our communities, particularly with the Native Hawaiian, Pacific Islander communities, higher infection rates, but also very, very sadly, higher mortality rates. We also found that in terms of messaging, this is where language and culture really matters. Being able to promote this notion of we're all in this together, and there's a greater value in getting vaccinated to protect our loved ones, our friends and family. It's a very family-oriented, community-oriented messaging. Also, what we learned, not surprisingly from where I sit, is that over half of our surveyed respondents have experienced some level of discrimination since the pandemic began. And then also over 1/3 of our community members openly stated that they could appreciate and understand that their mental health and well-being was deteriorating. That last point I really want to amplify because from a cultural standpoint, not unique to the AA and HPI communities, but certainly a profound point that I want to underscore. Culturally, for us, we do not tend to openly talk about mental health and wellness issues. It's that classical stigma factor. And the fact that the survey underscored that mental health and wellness is going to continue to be a growing concern for our communities, and I think it's really important. Lastly, for our audience who's joining us for this discussion, the CDC just released their data right before Thanksgiving and highlighted that for elders, seniors who are eligible for the COVID vaccination, 65 and over, only 40% of the Asian population, 65 and older, has received their booster shot. And then when we look at the Pacific Islander community, that drops down to only 35%. The last survey that I do want to highlight, we're just now starting to talk about it, so I want to share this with your audience. Again, in partnership with the COVID Collaborative, trying to think about big picture, the generational impact of COVID. We jointly released a report earlier this month called The Hidden Pain, Children Who Have Lost a Parent or Caregiver. And I think this is an important thread for us, going into 2022, thinking about our families and our communities. Of the over 800,000 fatalities our country has experienced, believe it or not, almost 170,000 children, so those under the age of 18, have lost their parent or their primary caretaker. So I think this opens up a whole new outlook and invitation to dialogue on how we are going to continue as a nation to deal with the consequences of COVID, Priya.
Yeah, Juliet, thank you so much for sharing all that data and the multiple sources from which you have obtained the data. And that last point you make about children and the loss of caregivers is particularly heartbreaking to hear how many of those children will be without a parent and caretaker as we move forward. And it is a critical challenge for our community and for building confidence really in the vaccine in our community and especially with our children. You touched on some of the challenges, but what may you not have covered so far in terms of some of the challenges to building confidence in the vaccine in our community?
Yeah, absolutely. The challenges, I call them classical challenges. And in that category, it is, especially from a public health lens, we all, every day, every week, we need the most updated information in a way that is understandable and digestible. And so if you carry that forward to our communities, one of the largest challenges really is making sure that information is available in a timely fashion to our communities that is linguistically accessible. So information available in our languages, and certainly in a way that is culturally relevant. To complicate the matter, it's so important to be able to get that timely, accurate information out in language and through trusted cultural navigators, if you will, to counter, the misinformation, the myths, the pending questions. And so I would say being able to, and again, thinking about the AHA network, being able to promote our trusted leaders and our navigators. That could be the head of a local community organization. That could be a faith-based leader or a small business owner or your locally elected official or that community leader that heads up their organization. And so with the AHA network, I would ask, as a solution, as an opportunity and invitation going forward, when you have the opportunity to speak with the public, are you already reaching out to your network of AA and HPI communities locally to invite that trusted leader to stand beside you, to stand next to you, to promote messaging on COVID vaccinations? I think the other thing I want to ask and invite all of us to think about, two more things. Number one is there has been a tendency to talk about COVID vaccination hesitancy, But for our communities, what really resonates is this notion of, if you don't think about you, let's think about our loved ones and our communities. And so what can we do and reframe our messaging towards vaccination confidence? So I think that's a really important messaging point. And then the last thing, but also very, very important, Priya, you and I have had a chance to get to know each other. There are community organizations and leaders out there, but I always worry and think about those who may not be affiliated to, a community organization or these communication channels. And the best way to support folks getting their COVID vaccination and building confidence, believe it or not, is making sure individuals have the time and their employer's support to take the time and care to get their COVID vaccination. And in that spirit, we've partnered with Made to Save, a national campaign, where now we're really focusing on vaccinations for employees and employers. Because what we are learning is when employers come out and say, we want each and every employee to feel comfortable to take the time off, to figure out transportation to get their vaccination, that is actually what's also making a really critical difference that, I think all of us need to take into account.
Yeah, I think both of those are really important points, and I just want to reiterate them. Having employer support is so important for our community, and creating sort of those pathways from the employer to be able to take the time and have the transportation necessary to get vaccinated. And then the second piece that you mentioned was the messaging around loved ones in the community and how increasing vaccine confidence will allow individuals to protect their loved ones and communities. I think both of those are really important points. I want to turn quickly to kids, right? So eligibility for vaccines is now expanded to kids age 5 and up. How are kids doing in your community? What are you seeing, and are you doing anything, or are you working with any other groups to foster confidence in the vaccine for children?
Absolutely. This is such an important area. I do want to highlight at least a couple of our critical strategic partnerships. Number one, I already mentioned Made to Save. Together with Made to Save, we're braiding our respective networks so that we can expand our reach as quickly as possible. And in partnership with Made to Save, we're developing a multilingual guide for parents and guardians by answering some of the most frequently asked questions. So I invite your network to check us out through madetosave.org. And it really is talking with our network of partners and responding to those questions that are really top of mind for any of us and all of us. But again, making sure that's available in as many languages as possible. And I'm really proud to share at the Health Forum, we do have a new tradition where we strive to translate all of our toolkits at a minimum of 10 languages, but we're really trying to strive for 20 to 30 Asian, Native, Hawaiian, Pacific Islander languages. Some of the key questions that we've heard and the concerns are, what are the long-term effects of the vaccine? What are the benefits of the vaccination? And so really coming out in language in a culturally relatable way to talk about these questions, it is what's going to boost parents and caregivers' level of comfort to make sure and ensure our young people get their COVID vaccination. To add to that, we talked about we need to think about where are the parents coming from, where are the caretakers coming from. And what we've learned is partnering with schools, so making sure that vaccination opportunities are available at school, maybe through an after-school program, again, together with community navigators and partners are critical, and to really enhance and amplify the lessons that we're learning we have continued to grow our national health response partnership in COVID. The Health Forum is very proud and humbled to lead a coalition of over 30 community-driven organizations at the national, state, and local level within the AA-NHPI community. So anytime we have a toolkit or we have new materials in very rapid fashion, we're able to deliver this across our network, across the country.
Yeah, thanks, Juliet. I'm always so impressed and amazed at your network through the Health Forum and how many different community organizations that you're able to reach with these messages. And I know that we really appreciate the conversion of a lot of these tools and resources into multiple languages and have been able to share those with AHA hospital members. And we hope to be able to continue to do that as we move forward. And since we're talking with hospital and health system leaders, what's one thing that the healthcare system could do that would help increase confidence in or access to the COVID vaccine in your community, particularly for children?
Absolutely. I would say the one thing, if we take our entirety of our conversation here together, this effort has to be at the local level. And so I would ask your network to think about making greater investments. Some of this is investment of time, sometimes it's investment in dollars. But if you don't already have a community advisory group of AA-NHPI leaders, I know within each individual AHA member in your community, you will have a set of AA-NHPI community leaders. So please, if you haven't already done this, create a community advisory group, an infrastructure to invite these leaders and these trusted spokespersons and ambassadors to guide you with your work. But immediately, even for the year end and the new year, you can invite these leaders in to share in the creation of shared messaging, particularly in language, making sure that you have resources to provide information in languages. Yes, it's an investment, but candidly, it's a very small investment with incredible impact. And if you're still figuring out how you do more with translations and providing translated materials, at a minimum, I would ask you for your local leadership, your network leadership, when you have public speaking engagements, if you have photo opportunities, do you have leaders standing next to your leaders who look like our communities? And so that might be as simple as a photo op, but making sure you're surrounding yourself with the diversity of your communities, whether that's AA, NHPI, Black, Latino, or Native American. I do think that visibility of a shared effort, a photo says so much without the spoken word. That's something that's low cost, but very, very intentional that I'm trying to ask more and more folks to think about and adopt. And that's based on a footnote, especially when you're interfacing with an largely immigrant population. I want to be frank, this notion of trust in government or trust in large institutions, this is still a very sensitive, fragile conversation, particularly for our communities. So those are just a couple of suggestions that I share with you today, Priya.
No, those are great suggestions, Juliet. And thank you so much for taking the time to talk with me today and to share these messages with our hospital and health system leaders. I think it will be really helpful as they engage with the AA and HPI community. And thank you also for your continued partnership and the partnership of the Health Forum. It has been extremely helpful for us to be able to talk with you throughout this pandemic and learn from what you are seeing on the ground and then share that with our hospital and health system leaders. So thank you again for your time, and we'll talk soon.
Great. Thank you so much for your leadership and friendship, Priya.